Assalamu alaikum. Good afternoon to all. So we are going to discuss about the innovative changes in the health industry that happened in the recent years. We have a very good specialist in the panels. So we have Dr. Danish Salim. He is an expert in the emergency medicine, and he was an innovator also. And we have Dr. Monica and Dr. Shaik Balkhis Banu. Both are associate professors from Fatima College. So we are going to start the discussion. So we start with Dr. Danish Salim. Dr. Danish Salim, we know that for the past recent years, AI is the game changer. Lot of the revolutions had been happened for the recent years, and it's going to happen in the upcoming years also. We know that starting from the wearable devices, which was not known for us for the past 10 years, but it's a common to the human, and they can easily identify the monitors, SpO2, the ECG, and all these basic elements. And we know the telemedicine, how it controlled the world during the time of the pandemic. And we know what Google is doing in the terms of basically in the imaging technology, their DeepMind, if I'm not mistaken, Google DeepMind AI, right? And even the Watson by IBM in the field of pharmacy and especially in the imaging. Then we have Da Vinci, the robot, which is doing the excellently performing in the world. We know in the preventive medicine also, lot of chatbots are available in the virtual medicine. Lot of advancement had been happened on these industries. So, can you explain to us, to the common people, how this development had been happened for the past years and what is going to be the next years, what is going to happen in this industry? So, please, sir.
Hello. Hello. Assalamu alaikum. Okay, I want some attention, please. Hello. 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 Okay. Do you think AI as a threat or a blessing? What do you think? Blessing or a threat? Both. How many of you think that it is a blessing? How many of you think that it is a blessing? Okay, how many of you have mobile phones? How many of you have mobile phones? Oh, great. All of you have. So do you still think AI as a threat? Huh? So first thing I want to say, don't think AI as a threat. Okay, that's the first thing you would. It is going to help us in having a better life. So always think AI as a friend. Then only you can acquire the changes which are happening in the world. Okay? So when I started my career 14 years back, so I was like a normal doctor who was working in Kerala in an emergency department. Are you listening? Why this much sound then? Why this much sound? Can you stay low? Very good, very good. Okay? So, please listen, because I'm coming from Dubai only for 30 minutes, just for talking something. If possible, we will share some good information. Okay, so when I started my career, we have to think about problems. So everybody can innovate. Even a person who does not know anything can innovate. Actually, I have done lot of innovations in Kerala. I have received State's Best Innovator Award in 2015. No, just not for applause. I'm just telling you. In 2018, I got National Innovation Award from Indian government, from Cabinet Minister. I got the National Innovation Award for a doctor who does not know any engineering thing. How I did? So I identified the problems which are there in the system. So every system has some problems. For example, if you think about a patient who is lying down after an accident in a road, what is the problem there? Somebody is not calling the ambulances. That's a problem, right? That's a problem. I identified one problem. Second problem, if the patient is lying down in a road where the ambulance cannot go, then that is also another problem, right? Second problem. Third problem, even if you call an ambulance in mobile, they cannot come because they don't know where is the ambulance. So what I did, first thing, launched a bike ambulance because it's available throughout the world. So why can't we get it in Kerala? We launched the first bike ambulance in Kerala by Fahad Fasil. So this became a huge hit. We saved around 900 patients in 1 year. So we were able to go to the remote places with a jump kit. Jump kit is, do you know about jump kits? So jump kit is also a new thing in Kerala, and it is now used in KIMS Hospital, Aster Hospital. Many hospitals are using my kit. It's already, the kit is named as Dr. Danish Innovation Kit. So what does it contain? It contains 50 equipments and 50 medicine which can be carried in a bag. This anyone can think. This is also an innovation. The question was about AI, but when we think about small things, there are many loopholes and there are many deficits in our system that we have to fill first. You can think about ChatGPT, you can think about bigger things, but first you have to think about the problems which you are facing in daily life. Daily life, are you facing any problem? Yes, the patients are not coming to the hospital in right time. So what I did, I went to Infosys, I spoke with some engineers. We have 10 people who worked for me day and night. They developed a software and we connected all the ambulances in Kerala with the help of Kerala Police. And now the Kerala state is using my app. 1,800 ambulances are there. So anyone can do this. I don't know anything about this software. I only had the idea. What I did, the ambition which I had in my mind, I collected the engineers. I spoke with them continuously. We were discussing with them. Then I wanted to launch it very widely. Then I went for Indian Medical Association. We had a talk for many months. Then later on with the police, finally the Kerala police bought our app. So now Kerala police is using this. So anyone can fill these things. It's a very small thing. When you think from behind, when you think now, anybody can solve this. Whoever sitting here can solve this. But till now, like for that many years, nobody have thought about it. About a kit, about a bike which can go into the rural areas and can save life. Those things can be easily done. And about the newer advances. In Sheikh Khalifa Medical City, what we are doing is, we are interpreting the X-rays and CT scan without the help of doctors. See, it should be a threat to us, but still we are not afraid, because the previous panelists, what they said, we have to upgrade ourselves. Last month I went for a training which is called ECMO training. It's called connecting the lung and heart outside machine, and we are actually operating. I am actually almost 41 years now. I went for a training because otherwise AI will take my place. So I have to upgrade myself. I know this. So everyone who is sitting here, you have to upgrade yourself always, even if you have a better position or better job. So that's a small introduction I want to give, because the other panelists also there. So let us hear from them and then we will answer the further questions.
Thank you, Doctor. Actually, your innovation is greatly inspiring to us. As a doctor, but still you are in the field of technology and navigating all the ambulances, the two-wheelers. It's really a good thought, and a huge applause from the side. Thank you. Then next we move on to Dr. Monica. Dr. Monica, she's an associate professor for Fatima College of Health Sciences. So she's specialized in the pharmacy department, right? So we know the pharmacy, the tablets or the medicines, it's quietly very expensive, especially for the diseases like kidney, like this heart disease and all these things. So what are the advancements happened for the recent years to reduce the cost of the medicines by AI?
Yeah, good afternoon, everybody. I must say that AI is contributing a lot when it comes to drug discovery. Why the medicines are so expensive? This is the first question. The medicines are very, very expensive because of the investment pharmaceutical sciences are putting into. The industries, pharmaceutical industries are putting a lot of money in research, but the duration of research is approximately 15 to 20 years to bring one medication in the market. But with the help of AI, now the duration is going to be reduced, the cost is going to be reduced. This is the one aspect. It takes around 15 to 20 years to bring one medication into the market. But with the help of AI, the analyzing of data and everything is quite easy now. And we believe that instead of 15 to 20 years, the duration would be 5 to 7 years. So that will definitely reduce the cost. This is the one thing. Second thing, we are targeting, very targeted medicine. So by having a lot of targeted medicine, the cost reduction would be there. And I have seen a couple of projects which are related to AI, which students showcased, which is related to diagnostic, which is related to formulation development. They are quite creative, quite innovative. So I think with the help of AI, the cost is going to be reduced automatically. Thank you.
Okay, so we can hope an advancement in the R&D so that it may reduce the cost of the medicines. Hope for the best. Then we move on to Dr. Shaik Balkhis Banu. She is a physiotherapist by profession. We all know, doctor, physiotherapy means it will start with pain. Okay, so what are the advancements we are expecting by through AI, especially in the imaging sector or whatever may be the, I'm not a technical expert to comment on that one, but you can explain on that one. How the pain can be reduced.
Sure. Assalamu alaikum. Myself, Dr. Shaik Balkhis. I work in Fatma College as a program coordinator and assistant professor. So from Aleen, because we have 5 campuses of Fatma College. So firstly, I would like to thank all of you for the organizers and also the students and everyone present over here for giving an opportunity for us to participate in this valuable event. As Mr. Moidu asked us about the technology or advancement in AI in physiotherapy, so healthcare sector is upgrading themselves in every aspects. If you are trying to see about physiotherapy itself, physiotherapy in AI at this moment as a research supported type of thing is very much helpful in the older generation conditions, especially Parkinson's condition, paralysis conditions and all this, where the patients will be bedridden for a long period of time and they need to have a 24/7 caregiver to take care of it. And sometimes they miss this opportunity to look into a vital falls, risk of falls and everything. So there are some of the devices which has been proven to be very effective, like watches, sensor watches, and also some of the telemedication for the pain management, and also for the watching the patients to avoid any type of a risk complications plays a vital role in AI in physiotherapy at this moment. I am the speaker for one of this topic in evidence-based type of AI physiotherapy in upcoming conference of physical therapy rehabilitation in February in Abu Dhabi. So while I was going through this, I noticed this, some of the major areas had benefited by the AI. One is about the pain management, as he mentioned, where the low back pain patients has been positive results, as they are having a continuous type of monitoring about their posture, maintaining their posture, and giving an alerts about how to have the medications and everything at the timings, and also the older and geriatric population. So there is a long way. We cannot say that the AI is just this generation. No, it's going to be upgraded, as most of the panel members have discussed. So there is a lot more to come. Okay, thank you so much.
Okay, thank you. I hope our spectators having some of the queries. So you can ask the questions. It shall be answered by the experts. So please.
Thank you. So I have a question. How can emerging technologies like AI and telemedicine work together to make healthcare more personalized and efficient while ensuring privacy, accessibility, and fairness to everyone?
personalized medication?
Dr. Danish can explain better on this query.
So most of the countries are following, from where the question came, I didn't see the person. Yeah, okay. We are following HIPAA complaint. Do you know about HIPAA complaints? Do you know about it? Yeah. So we are following certain rules actually. The data cannot be leaked like that. So we are not revealing the patient data to anyone. And the software have certain features that the patient details will not be going. It will be masked, and it will be only the data will be analyzed. So regarding these medicines and back pain, all those things, what we have right now is data. And with the help of ChatGPT and all other newer technologies, any data can be, we can get the result within seconds. That's the advantage. So anyone who have some brain can sit so instead of sitting for months, now we can sit for hours and find out where is the exact problem. For example, a drug called amantadine. Okay, it's used for Parkinsonism and all. We can find out whether this medicine is really working or not. We can get the feedback from the patient. We can get the feedback from what are the side effects of from the medicine. All those data can be put inside, and we can get all the results in within seconds. And how much dose to be used, everything can be analyzed very soon. So what I am seeing is there are a lot of changes going to happen within coming years. So as I told before, if you want to innovate something, as students I'm saying, you have to think about common problems. Don't think about bigger things first. Think about the common problems you face. Whatever the problems you face, you will understand it better. So nobody will understand a person who is lying on the floor, bleeding. A common man will not understand, but a doctor will understand. If he is coming late to the hospital, what are the problems he will face. So if you are in a particular sector, and if you are facing any particular problem, you have to think about that problem, try to innovate new things to get it solved. There are a lot of technology available right now to help you out. There are many mentors also available right now. You can anytime contact any of us. We will help you. There are many possibilities now, not like before.
Doctor, what are the advancements in the early detection? Because we know that early detections can cure the better result it can be happen. So what are the advancements in that?
There are a lot of advances happening in cancer detection. So previously the breast cancer was not identified this much faster. Now even if you get a breast cancer, it is 100% curable. I cannot say 100%, 99% curable, because we are detecting in the early stage. And now AI, with the help of in the mammogram itself, the AI is incorporated. So AI can detect even the smallest lesion and can find out the cancer, breast cancer. So breast cancer is one of the area where it is used. Recently, few days back, I read an article in that it was shown the pancreatic cancer. It is one of the deadliest cancer, and it is one of the dangerous cancer. I know one of my close relative who is having pancreatic cancer is very detected very late. But now with the newer technologies, with newer advancement in treatment, we can detect these type of cancer earlier. Earlier the diagnosis, better will be the treatment. So that's the thing. So definitely it will help in diagnosing all those things.
Any queries from the spectators, please? We want the session to be an interactive session, okay, please.
I have one question. Now, in all fields like medicine and in every technology, this AI is implemented. But in our curriculum, is it started? Is it implemented? Because all of the students now, they are looking for higher studies. After 12th, they are going for medical or engineering. Is this AI technology or related items are implemented in our curriculum? Is it started?
I think our associate professors can answer on this one, please.
Yes, as per the MOSER event, Ministry of Higher Education, they have made it mandatory to introduce AI and the innovator courses in the curriculum. So it's already there in the curriculum. Let's talk about the pharmacy. What we teach our students through AI, how the drug discovery and development take place, how the new drugs comes to the market, how do you analyze the data, as I said, how to make it cost effective by reducing the years of research in bringing a new drug to the market, how to bring a very efficient drug into the market. Like there are a lot of anti-cancer drugs, but they are not very potent, how to make them very targeted oriented. So this is again taught with the help of the AI. So it's already being implemented in our curriculum and it's mandatory in fact. Thank you.
Further questions, please.
Yeah, good evening all.
Yeah, very good evening.
Yeah, see, related to that question, just want to ask you, see, we are sending our students, our children to the professional courses. So in this new age, you know, AI is affecting all sectors, not only healthcare, in everywhere. So what would be your advice for our students to get all these new courses or anything related to the healthcare sector, AI related courses? It will help on healthcare sector. That's my question. So anyone can answer.
Dr. Danish, I think he's a consultant also. So he's doing some training programs for the students, so he can better explain on this matter.
So this question has two parts. So basically, if you want to get training, for example, if your son or daughter wants to get trained in a newer courses, you can always research on these courses, and many courses are available in UAE. Many courses are available in different parts of the world. But when you think about a medical course, I will tell about the pancreatic cancer because it will have a continuation. So pancreatic cancer is treated by a treatment called Whipple surgery. Okay, in that the pancreas will be removed, the duodenum will be removed, the small intestine will be removed, the stomach also will be removed. That is the treatment of pancreatic cancer. But when I asked a doctor, very famous doctor in UAE, how many Whipple surgery you have done in your life, he told me 60. The same question I asked a junior doctor who is maybe 10 years graduated from an Indian medical college. He told 600. That's the difference. So experience always matter when the patient, when it is about the healthcare. But about the technology and the AI related things, you have to go with the latest colleges where they are following the curriculums. For example, Fatima College is incorporating many types of artificial intelligence. But first of all, our students or our parents should think about it. We have to, so what we are thinking, we are only thinking from our parents' perspective. We should not think like that because the world have changed a lot. From last 5 years, the world have changed like anything. So in next 5 years, it will change again very fast. So we have to make our children understand that the world is changing and we should study something which is not there in the books also. Don't think that everything will be available in school and everything is available in your school curriculum and all. There are so many institutions are there. Actually, I have an institute in Electra, Dockstar Institute. We are actually under the private office of His Highness. So His Highness' ambition is to keep innovating and to bring these type of courses to young students. So we are continuously keeping classes. So I actually congratulate the organizers for keeping such type of classes. I think this is the first time we are doing this, right?
Yeah, it's first time.
This is wonderful and it should be welcomed because everybody should start thinking that we are not living in a world which is like 2010 or 2015. It is developing very fast and we have to go accordingly.
Any further queries, please? Yeah, she is having one query.
So this is to the panel as a whole. Is robotics also included in the medical syllabus for doctors now, or?
I'm not a doctor.
Okay, so robotics will come as a surgery specialty. For MBBS curriculum, till now, as far as I know, it's not included. Maybe in states it may be there, but I don't, in Indian curriculum and UA curriculum, it is not there. But we are going for additional programs for 5-day, 7-day training. I have recently gone for a training for bronchoscopy, like entering the lung and seeing each lobules and all. Personally I went for the training. So I recommend actually, even my residents, I always say them, even if you finish your degree, don't stop there. As a doctor, you cannot stop. You have to keep learning. You have to go for new courses. Same like every specialty or every sector will have newer advances. you have to go ahead. And robotic will come in surgery specialty. Surgery and those specialty robotics are there. It's there already available.
Thank you, doctor. Thank you.
Okay.
Thank
Shahid,
you.
I think he's having some query.
There is a question from one of the student from project ID C9, and then I will come to C7. Yes, please.
So my question is to all the panel, and how can we, the students, bring our innovations, our AI innovations to the wider eyes of the government, the local authorities? How can we capture their attention and bring our innovations to a wider audience?
I would like to add some of the points for the two of the questions that recently which we have asked. One was about the curriculum, about how it is going to be helpful in the schools and in colleges. In Fatma College, almost from past 10 years, we are on a standardized type of innovation courses. The student comes for the third year and they go on with all the innovations with the different departments, what they want to do, and then they need to present the topics to us. We have sent some of the very important projects for Fatma, His Highness Sheikh Fatma Award, and also some of the projects which I'm answering to his question that we have sent it for the WHO too from the different departments. And from past 3 years, Fatma College is also very much integrated with this AI and robotics. In physiotherapy department, we collaborated with Amana Healthcare for virtual reality. Some of the projects has been done and it has been implemented, especially for the VR type of devices. And one of the projects which we have also did is about the pneumatic type of garments, especially for the lymphatic drainage system, which was also successful. This was done and with the Tamam Hospital, one of the Tamam Hospital staff in Srini in Aleen. So we have a different type of platforms where we are showcasing the students' innovations for the government and also to the international levels. So this is one of the things. So by default, whenever the student comes to our college or any colleges, we have a curriculum which needs to go through AI, robotics, and also the innovation. That is a mandatory topics which we are teaching. Yeah.
Okay, thank you.
Thank you for your response. We'll take the last question from project ID C7.
Okay, so for the panel as a whole, some innovators say that AI and robotics can be included for surgical procedures so that the doctor doesn't have to be present in the room. So what if the AI robots and all mess up the surgery? Wouldn't that put the people's life at risk?
Can you repeat the question, please?
No, is it regarding the accuracy of the surgery done by the robots, right?
Yeah.
Surgery.
Yeah. It's regarding the precision. How much is the precise this operation is?
So the statistics is shocking. 80% of doctors' errors are eliminated by artificial intelligence. 80% radiology error. So that is shocking for me also. Even I never thought that this much errors are there. This is a recent study which is published. If you search in Google, you will find out. So you are not seeing much innovations in healthcare widely because in background these things are happening on. And it will be released only when they are 100% sure that this will not cause any problem to the patient. So that much time they will evaluate, re-evaluate, and then only this will come to the market. So we have to think positive. AI will definitely take over some of the jobs, especially radiology. I think in India, my brother actually, he's also an emergency physician, but he wanted to do a radiology. So that time the fees itself was 40 lakhs per year. I told, this is not worth, I told that, I think 5 years back I told, AI will take over. But now, most of the radiology department in US, they are actually having only a supervisor. 10 doctors' job is done by an AI, and supervisor is checking whether it is correct or not. So 10 doctors' job is gone. So these type of things can come. So what we need to think is always go ahead with learning new things. About that question, how to go to the market or how to get the showcase here. See, I have done in 2009. There was no social media. There was nothing available. What I did, what I can do, we have to keep doing. I trained around 1 lakh people in 1 year. This become a news in all the newspaper. So people will start thinking about you, will start discussing things about you. Because you should not think that everything will have result. My many innovations, I lost around 150,000 dirham in 1 day. 1 day, by doing some innovation. I got some devices from US and all got spoiled in 1 day. So those things also there. When we tell about success, we will not tell about failures. Because failures always is a step. And don't be disheartened. Even if your innovations are not going to the public, don't think about it. You do with your passion. What will happen? If it is really worth, definitely one day it will come up into the public. And now there is social media. There are so many influencers available. You can actually ask them to do your video. It will go have a wide reach. It's very easy for you to showcase anything now. It's not a tough thing like before.
Okay, thank you. Shahin, you have any queries? I think
Yes, please.
Mr. Abdul Qadir and Shahin is having queries. Please.
My question is to Dr. Danish. What is the role in researching medicines in AI, like DMD, muscular dystrophy type of?
Yeah, muscular dystrophy and certain diseases, we don't have any particular medicine. So, means the medicines are not proper. Even if you give, the patient have very bad prognosis. There are so many diseases like that. So, for example, even multiple sclerosis, muscular dystrophy, there are so many conditions like. But AI is promising. It will have a very good result. And see, it all depends upon where you place the drug and how you will do a proper randomized control trial. If you are able to do randomized control trial fast, usually it will take 4 years, 5 years for a drug to come up. But this AI, if it is there, it can speed up the analysis and it can avoid the bias. So any drug which is coming to the market, it is biased. The bias means they will close the doctor's eye. That's what we say. With not closing, the doctor will not know what is happening exactly. So it will be evaluated by some researchers and scientists there is a separate wing which is happening. So those things can be faster when there is AI. So many new drugs can come into picture. So that is again a promising thing.
Shahin, you have any query, please? Please hand over mic to him. Please.
Hi, my question is for the panel as a whole. Actually, for now, great advancements are done in the field of AI and data science, especially in the big tech companies. Also, drastic measurements were taken in the pharmaceutical and response field as well. My question is, recently I have read a research theory paper where there is an improvement in automated image analysis in MRI scanning, especially in cardiac MRI and everything as well. My question is, what are the limitations that's bringing into the diagnostic and consultation medicines? I'm not talking about overshadowing the roles of doctors, but using these AI tools as an assistant for doctor in better easing and for access for the patients as well, for MRI scanning and interpretation.
Okay, imaging, right? Okay.
So I have said this before. See, in COVID time, when there is a COVID time, we calculate the COVID score, contract score, like with the CT scan of the chest. For every patient who is coming to department, we will ask them to do a CT scan just to see how bad the lung is. So based on the score, we can treat him actually. We can tell him, okay, this patient will go to ICU, this patient, because we can early detection. Even the patient become worse, we can easily identify with the help of this score. It's called contract score. So this score was automatically calculated by the AI. It was available now, before like 4 years back. So we were calculating automatically. When the patient goes into the CT scan, the calculation will happen automatically and the doctor will only cross-verify and check it. So a lot of automations are happening on, but we want a 100% accuracy. We will wait till 100% accuracy to avoid the errors. So currently, everything is supervised by doctors. Everything. Till now, nothing is done by AI as such. But in near future, I'm 100% sure this will go out. Even doctors, no need of doctors. Because a person who is having a breathing difficulty, and if he is able to speak, the AI will ask some questions. He can just answer it. AI will tell, okay, select what all the symptoms you have, what all the symptoms your dad had, what all the symptoms your mother had. Everything you can select. The diagnosis will come. Okay, automatically if you keep the hand, the blood also will be taken. He can go to a room where there is no human available. There CT can be taken or MRI can be taken and the result will come. So the treatment, everything will come automatically. This will come very soon it can happen. And I think in China, they have opened one hospital. It is completely automated and they are using artificial intelligence for a trial basis. They already opened. So in coming years, we can expect these type of changes.
Yeah, even virtual doctors, boards, it's available even in USA, even in UAE also it's available, if I'm not mistaken. Okay, so there are a lot, you have...
Yes, thank you audience, thank you students for your wonderful questions, and thank you panelists for responding towards the audiences and the students. Over to the moderator, Engineer Hyder, sir. So you would be able to close the session by giving a conclusion. Thank you.
Before concluding the session, I request Dr. Danish, because he is an innovator also. What is your advice? We have a lot of junior innovators here. You see that they are doing a tremendous work here. So what is your advice to them?
Hello. So now every complete silence. Do you know about Ikigai? How many of you know about Ikigai? Ikigai. What is Ikigai? The meaning of life. Okay. So can I explain in 1 or 2 minutes? Okay?
Yeah.
So you have to know about 4 things in your life. 4 things. What you love, what you are good at, what is your profession, and what the world needs. What the world needs. So for example, if I think about me, I am good at speaking, I am good in communicating. I know that I am good in communicating. I am good in treating patients. So I know that I am good at. So you have to find where you are good at. As a student or as a parent, you have to find which is a skill or where you are good at. You have to write down. Take your time. Maybe 1 or 2 days. Maybe 5 days. Take your time. Write. What are you good at? Second thing, what is your skill? Sometimes you may be good in writing. You may be good in painting. Sometimes you may be good in doing some works or projects or studying. So studying itself is not only a one thing. There are so many things. So what is your skill you have to identify? 2 things. Then profession. Profession, you cannot select it right now, but later on as a person, I selected the doctor profession. So I know that I can earn some money because I want to live also. I want to look after my family. So I have to live also, so I want some job. So I understood that I can earn money by treating patient. I can earn money by teaching students. I'm teaching, continuously I'm teaching. Today morning, 6 o'clock I started my journey. I went to Dubai, I took my class, then I came back here. Now again 5, 7 o'clock I have another talk. So continuously doing because I love this. So the third one is, what is your profession? You have to identify which all area where you can make some money for your living. Then final things, what the world needs. The world needs something. I told you there are many gaps in our system that you have to identify clearly and think whether you can solve this by your thoughts or with the help of other doctors or other person who is nearby. So connect everything together. If you can connect everything together, ultimately the meaning of life will come. This is my message for you, all of you. So keep innovating. Don't think, don't restrict your thoughts. Sky is the limit. Even sky is not the limit. You can go above the sky because that much amount of information is available in our hand. Mobile itself is enough for you to innovate many things. Because if you think about a king who was ruling India or a UAE 20 years back, we are 100 times better than them because our technology has advanced. We are going in a car where he cannot travel. We are using mic. There was no mic that time. So many things have advanced. So we have to think that we are blessed. My message is AI is not a curse, AI is a bless.
Thank you for your inspiring words. We have lot of things to discuss, but our time is very limited. Lot of sessions to going on also. In future also definitely we will meet in this floor. The discussion it was very much fruitful, very much inspiring, and in fact it was very much informative also. As we all know, the technology, what is the purpose of the technology? To make the life of the common people easy, cost effective, and obviously painless also. So this is the purpose of the technology, and that's how the research are going on, R&D is going on. So thank you. We wishing for the best future for the upcoming years. Thank you for all. Okay.